Hi everyone, welcome to today's BSc Sport and Exercise Medical Sciences taster session. So firstly, thanks very much for joining us. My name is Nicola Simonides. I'm a current BSc Sport and Exercise Medical Sciences student here at UCL, and I'm chairing this session talk this afternoon. So we're hoping that it will address any course-specific questions you might have and help you gain an insight into what it's really like to study on this program, so on the undergraduate program. So this afternoon, our speaker, Dr. Flaminia Ronca, as you can see, is going to address how you can improve sport performance, prevent and manage injuries, and apply exercise for the prevention and management of diseases in clinical populations. Then Flaminia is going to outline the structure of the BSc program. There is going to be a Q&A session, and there's going to be plenty of interactive opportunities, so you can definitely join in throughout the session. It is being recorded as well, and it will be made available on our website, I assume the ISCH website following today's event. So definitely we are here to respond to any questions, so please don't be shy to use the chat function on Zoom and we'll get back to you. So to introduce our speaker, Flaminia, she's the Program Director of the IBSc and BSc courses in Sport and Exercise Medical Sciences at the Institute of Sport, Exercise and Health. And at UCL, she delivers a unique and innovative program that hopes to produce experienced graduates with practical experience and insight in clinical applications of exercise and physical activity, importantly in both clinical and athletic contexts. She's a strong believer in research-led education and involving students in all aspects of the research process. She supervises undergraduate and postgraduate students from multiple faculties to facilitate interdisciplinary research under the Connected Curriculum Framework. And that's my introduction. So thank you, Flaminia, over to you.
Thank you, Nicola. I guess I should be saying that Nicola is one of our best third-year students on the BSc. So she's been with us for 3 years, and she's now doing a very exciting research project that she can tell us all about later. And she's been running around in meetings all day and lectures. So thank you very much for making the time to join us, Nicola. Before I start, I can see that Anthony wrote a question. So thanks, Anthony, for finding a way to communicate with me. I'm very grateful for that. So I can see that you're interested in exercise and getting healthy, and you're interested in going into medicine, it's fantastic. So you'll hear about the focus of our course is actually more clinical, and although you do study about performance and enhancing the strength and speed of athletes through programs and supplementation, we do focus quite a bit on the clinical aspects and how to use exercise as a way to prevent and manage disease. So it's very much connected to medicine. So it's great to hear that that's one of your interests, because that's what we will be going into as part of the course. Do feel free to, so I'm going to share my screen now, but feel free to keep asking questions. I don't know if, Nicola, are you able to see the Q&A box?
Yeah, I can see it, and I can also type answers, so.
Perfect. So I won't be able to see that, so I'll let you keep an eye on that. Feel free to interrupt me, because I realize it's a bit boring to listen to somebody talk to themselves for half an hour. So please do pitch in if you see any questions come up.
Someone just asked a question, is obesity linked to the course?
Fantastic question. So yes, obesity is pretty much at the core of everything related to physical activity and health. And we don't have a module targeted to obesity, but we do study obesity and the causes and how different lifestyles can help reduce obesity and change health factors. So I'll make sure I address that as I go through, because we've got some student research that has been done on obesity and cognitive function. So how our brain work when we carry a bit too much fat in our body. So thanks for bringing that up, and I will touch on it. So sharing screen, sorry, seems like I can't do two things at once. And Nicola, if you're okay with it, I will be bringing you in throughout the program to get your insight on the course and the various modules. So here it is. Nope, that's not it. Okay. So great. So hopefully you can see that. Right. So I'll give you a bit of an introduction of the staff team. We'll talk about student research, and some of it does address obesity. So we'll answer some of your questions there. And then we'll go through the program overview, what you study as part of the program, and which careers you may go into once you're done with this degree. And you have a lovely piece of paper to prove how well you did. So this is part of the team that teaches on the program. And we've got lots of smiley faces here, but the main thing I want to show you is this information down here. So what you see is that we all come from pretty different backgrounds. We've got Paul Thawley, who's a specialist physiotherapist. He's worked in the Olympics for more than 20 years. He's incredibly experienced and has lots of lovely stories. You can see Nicola laughing because she'll remember many of the stories that Paul tells as part of his lectures. He's incredibly knowledgeable. So he's a great person to have on the team. We have Joe, who's a strength and conditioning specialist. Tom is specialist in supplementation and nutrition. So he does research on different supplements and how they can help our health and performance. Maddie is a sports scientist specialized in injury prevention. And Tom is a physiotherapist, and I'm interested in the brain and psychology. So you can see that there's a very diverse team, and we've got a new member who's not on the slide, who's specialist in cardiology. So you get quite a lot. And this is just the core sports team, but you are taught from a much wider faculty of the medical sciences division. So you'll have immunologists and epidemiologists and physiologists and biochemists and people from all sorts of backgrounds teaching you throughout your course. So I think that's one of the great benefits of studying at UCL, is that you get input from experts in lots of different fields. UCL itself, I'm sure you're already aware of this, but it is ranked top 10 universities in the world consistently. And depending on which ranking you look at, we're on different stages, and depending on what subject you look at as well, the rankings are between first in the world and 10th in the world, depending on where you look. So it's quite an exciting and stimulating environment to be in. And we have, so this is actually quite old, 29 Nobel Prizes as of a couple of years ago. So there's probably been more since. Diversity and equality are very strong at UCL. So UCL's history, I won't bore you with it, but I am quite proud of the fact that we were founded in 1826. And at the time, England only had Oxford and Cambridge as universities. And in order to get into Oxford and Cambridge, you had to be from a wealthy family, and you had to be of Anglican Christian religious background. So there wasn't a university in the UK at the time that allowed people from all social classes and ethnicities and religious backgrounds to obtain higher education. And so UCL was the first university that was built in London to allow access to higher education to everyone. Everyone meaning only men at the time in the 1800s, but eventually UCL also became the first women to grant, the first British university to grant full degrees to women in the UK. So it's quite an exciting history. I could go on, but I won't bore you with that. So you might be applying to study sport and exercise medical sciences, which we call SEMS. And SEMS focuses on merging medical sciences, so how the body works in health and in disease, with sport science, which is performance and exercise and physical activity. So we're bringing those two things together through evidence-based teaching. So we do quite a lot of research, and all of our research informs what we teach you. So we don't teach you from textbooks, we teach you from the latest research, from journal articles, and from science that is out there. And you get the most up-to-date information on how exercise can help prevent and manage disease, and how we can optimize performance in athletes. So that is essentially what you'll be studying. Now, we often get students apply to this course who say, oh, I want to become a physiotherapist, and so that is why I'm coming to UCL. This is something you should keep in mind. Feel free to take a screenshot of this screen so you can look at it later. And there's a link down here that takes you to a page with more detailed information. But what I would like to show you here is a difference between sports science, sports and exercise medical sciences, which is our course that we give at UCL, the one in green, and physiotherapy. So if you studied sports science and you became a sports scientist, You would know a lot about coaching and physiology and biomechanics and sports analysis in healthy populations only. You would not have a clinical background, so you would not study diseases and immunology and public health, so you would not touch any of that, and you would not learn how to rehabilitate injuries. Sports science does not teach about injuries. If you go to study physiotherapy instead, you would learn a lot about musculoskeletal and nervous diseases, how to rehabilitate them, but you would not learn how to optimize performance in athletes. You would not learn how to rehabilitate injuries. So you would learn how to assess injuries, how to identify them, how to manage them. But what you don't learn in physiotherapy is, once the injury is healed, how do I then make that leg strong again so my athlete can go back and play football? That is not something the physiotherapist does. So the physiotherapist heals the injury and manages it, but then you need to get the athlete strong again so they can compete again. And that is a bit that physiotherapy does not teach. So you would not learn how to design a training program, for example, if you study physiotherapy. So it's much more about clinical management and working with patients. What we teach in SENS is, first of all, you learn about both clinical populations and healthy populations. You get the scientific basis to work in both of these athletes. So optimizing performance and also preventing and managing disease. You get both of those. In terms of injuries, you do learn how to screen for injuries, not in as much depth as in physiotherapy. So you don't become a physiotherapist. You can become a physiotherapist if you do our degree and then you take an extra 2 years of conversion and you do a master's in physiotherapy. So you can become a physiotherapist afterwards, and many of our students do that. And you do learn how to rehabilitate injuries. So how that portion of how to make an injury strong again so I can compete again and I don't get hurt, that's what we do teach. So, Nicola, have you thought about what you want to go in after you get your degree?
I'm not sure, like I am quite strongly considering physiotherapy, but then I also like other aspects of the course. Like I feel like I'm interested in many aspects of the course, so it's hard for me to identify one, but I feel like the thing that this degree has shown me well is that like I think I do want to do some sort of vocation, like probably leaning towards physiotherapy, but I guess you could do nutrition or all sorts of things, and then maybe like get some knowledge, I guess, like in the practical world, but then maybe like with a long-term view, like I would quite like one day to come back more into like teaching, maybe research like at the university level, but that's like a long-term goal, I guess, to just take it one step at a time. But yeah, I think it definitely opens up a lot of doors, this degree.
It absolutely does. I'll make sure I enroll you on a PhD program then soon. But yeah, so you can see Nicola wants to go into physiotherapy, which is definitely an option. As I said, you can do a conversion degree. Some of our students are going into medicine, so you can do graduate medicine, which is I think 4 years instead of 5, if I'm not mistaken, or 5 years instead of 6. So those are options after. So we will get back to professions at the end of the presentation. I'll give you a bit of a flavor of what you would do during the degree. So as I mentioned earlier, each one of us has a different area that we specialize in. So my area is exercise neuroscience, Maddie works in injury prevention, Amelia works in population health, and we've got female health, et cetera, et cetera. So we all have a very niche area of specialty, and our students get to conduct their research project under us as supervisors. And these are some examples. I'll show you some examples of student research. I didn't set this up as a polling question, but if you want to put in the chat the answer to this question, if you could do a research project on absolutely anything in the world, what would it be? Would it be on nutrition, on supplements, on drugs, so doping? Would it be on physiotherapy and rehabilitating injuries? You can put it in the Q&A. Or would it be on obesity and so weight loss and managing comorbidities of obesity? Just 1 or 2 question, one or two words, if you want to put them in the Q&A section to give us an idea of what you're interested in. So nutrition, obesity. Oh, that's great. So we actually have a project running this year that focuses on nutrition and obesity. So Tom, who is this person over here. So he specializes in supplementation, and he's doing a student project on the supplementation with chlorella, spelled CH, chlorella, which is an algae, in overweight women, together with an exercise plan. So what he wants to know is what happens if I get a group of people to exercise and supplement with this algae, and does it improve their lipid profile, and does it reduce their adiposity, so their body fat, and does it reduce their blood pressure more than if they only exercise without supplementing. So there is some research done by other teams around this, and it looks like it works better than just exercising alone. So exercise plus nutrition plan work better than only exercising. So that's what our students are doing this year under Tom, which is quite exciting. Cool. So another few examples. So this was my research team pre-COVID, when masks were not a thing and we were allowed to see each other in person. And we were planning a very large research project with the Metropolitan Police, which was quite fun. And we were focusing on the health and well-being of police officers. And so we did look at nutrition, and we looked at exercise, etc. So these are the students collecting data. We did some brain imaging, and then we got them to do a bit of exercise in the lab. And this is some of the outputs that we got from the projects with our students. And what we found, which I found very interesting, again, if you're interested in obesity, where are we? Okay, I don't have the obesity graph, but it looked like this one. So people who were more fit seemed to benefit more from a bout of exercise. So if we focus here, we did a bit of brain imaging, and we got the participants to do a cognitive test before and after 15 minutes of high intensity exercise. And what we found on everyone, and that's what this shows over here, is that brain activity and cognitive function improve after 15 minutes of exercise, right? So the next time you have your A-level exams, before your exams, you go for a 10 to 15 minute jog, and you will do so much better on your exams. Or before you study, before you sit down to study, do half an hour of exercise, take a shower, sit down and study. You will learn better. You'll retain more information. So our brains work better after exercise. However, one thing that we found is that the people who were more fit, so up here, and who carried less body fat, benefited even more from this boost in brain power, let's call it that way. So the message is that exercise is good for your brain works better after exercise, but if you are more fit and less fat, then you benefit even more from that improvement, which is quite a nice message. And this graph down sheet here shows a relationship with depressive symptoms. So people who suffer from depression also benefit from improved brain activity in this area, which normally is less active in this population. So people who suffer from depression sometimes find it difficult to concentrate, but if they do a bit of exercise, then the part of the brain that helps us concentrate lights up and it works better. So lots of positive messages there. So this is what the fitness tests look like. So our participants and our students are wearing a mask that measures the oxygen and carbon dioxide that we breathe in and out when we exercise, and this gives us a measure of fitness, which is also called a VO2 max. And finally, this is from another student project, and what these students did is they gave their participants different forms of exercise. So they gave them 30 minutes of strength training over here, resting over here, 15 minutes of stretching over here, a VO2 max test over here, etc. And this one here is 30 minutes of a strong intensity exercise, bike ride. And The y-axis, which is this one, shows us the change in mood. So 0 means no change in mood. So if we rest, there's no change in mood. But if we exercise, you can see that everybody's mood improves. So these boxes are all above 0, which means that their mood improved. However, one of the exercise sessions made our participants' mood improve a lot more than the others. Nicola, can you tell which one it is? So I think it's the blue one here. I think.
Sorry, I was saying the blue one.
Oh, you were speaking. Sorry, I couldn't see you. You were muted.
I didn't realize I was muted. I thought I was wrong. I was like, why is she not replying? What have I been doing this degree for?
See, this is why it's best to do these things in person. So I'll repeat my question. So Nicola, which form of exercise improved mood the most?
The 30-minute threshold cycle with the highest line here in the box.
Yeah, exactly. So threshold cycle is essentially going quite strong. So like a good intensity bike ride is what improved mood the most, which is quite promising. So essentially what we get here is the message we get from this is that 30 minutes of a good intensity exercise. If you like to run, you go for a run. If you like bike, go for a bike ride. But that's what's best for our mood. But if you don't really feel like doing that, any form of exercise, even stretching, will improve our mood, which is a very nice message to tell people. So, and again, this was an excellent student project that we ran last year. These are other examples of equipment we have in the lab. So this measures strength, and then we have a force platform here that measures a series of variables of leg power. And our participant was so tall that we were scared he was going to go through the roof, so we had to remove part of the roof before testing him because we thought he was going to destroy our building. So just a reminder, if you have any questions at any point or any comments, feel free to put them in the Q&A section. We will be monitoring it. And we will move on to the program overview. So this is what you will study if you decide to pick this program. So we have the 3 years over here. Throughout the 3 years, you will have a series of modules that teach you all about how the body works and how that relates to exercise. So cardiovascular respiratory function. So Nicola, pay attention because I will ask you what were your favorite modules at the end. So you need to give me one for each year when I'm done. So we've got cardiovascular function. So you learn about the heart and the lungs and how they work in health and in disease. So you learn about cardiovascular diseases and pulmonary diseases. And you then also learn about how the heart and the lungs work when we exercise. So if a healthy person is exercising, what is my heart doing and what are my lungs doing? You learn all about the musculoskeletal system and anatomy. And then you learn in year 2 how to design a training program to make people stronger. And in year 3, you put all the information that you've earned in years 1 and 2 into a sports performance optimization. So which doping methods could I use if they were legal, or what nutrition can I use and what training strategies? Then you have a series of modules that are focused more on I guess anatomy, biomechanics, and injury. So you learn all about anatomy with Paul, and he teaches you how to detect, how to look at imaging. So how do you look at an MRI scan? How do you interpret it? So you don't become radiologists, but you learn to look at a scan and go, okay, I know what bone this is, or I know what muscle this is, and if it's injured or not injured. So it's quite a fun module. And then you learn about infection and repair and the nervous system. And in year 3, you learn about how to assess injuries and how to rehabilitate injuries, again with Paul. So you're taught by physiotherapists in that module. Then you have a series of modules that focus on nutrition, the gut, the liver, the kidneys, hormones, and pharmacology. So the system of, if I'm eating something or if I'm taking a certain supplement, what does that do to my body? And that culminates in sports nutrition in year 3. And then you have a series of modules that focus on health. So foundations of health and disease, health and behavior. So this is more from a psychological perspective. What do I do to help people stop smoking or drink less or do more exercise? And exercise medicine in year 3 is a fantastic module that focuses on how to apply exercise in very specific clinical populations. So if I'm working with a person who has type 1 diabetes, what type of exercise do I prescribe? If I'm working with a person who has cancer, what type of exercise would be useful for them? And what does exercise do to cancer? Does it prevent cancer? Does it exacerbate cancer, etc.? And so you go through the various clinical populations of that. And you have your research projects, and we've discussed a couple of examples of what previous students have done. So, and then you have, in year 2, you also have, if you wanted to, you have a couple of optional modules. So Nicola, which were your favorite modules and why?
Okay, I mean, I enjoyed most. I wouldn't say there's many modules that I didn't enjoy at all, to be honest, because it's nice how they all link into each other as well. Like you find that even if one that you didn't enjoy, if there's one you didn't enjoy very much, then like later on it links, so you can see why you had to do it in that sense. Like it might seem a little bit boring at start, but then like it links later on. But anyway, in the first year, I think probably the exercise physiology one was my favorite, just because it was most related, I guess, to what exactly what the degree is, the mixture of the biology and the physiology with the sports performance. In the second year, I think this is maybe surprised me, but I really enjoyed the nervous system and neurodisease, which is actually one that the medical department runs, not the sports department, but I guess it also influenced my decision of what research project to do, because now I'm doing one that mixes kind of cognitive development with sports outcomes. And then this year, obviously, we're still early in the year, but I am really enjoying the sports injury assessment and management. I've always kind of been interested in that, wanting to do that. Like I said, I'm considering physio as a career. So like, I'm quite interested because I did CrossFit for quite a few years and I'm quite into the gym fitness in general. I kind of like that almost transition or like bridging the gap, I guess, between rehab of injuries and then training someone to get them into proper physical condition and performance and stuff. So like maybe potential career there, but still keeping it open.
I'm so surprised because you not surprised, but you liked the exercise physiology in year 1 and you did it completely online, didn't you? Because that was the COVID year. Is that right?
Yeah, I mean, everything was online, to be fair.
Yeah,
so I feel
true.
It was probably just interesting to me. I like that we had the assessment that was to do the coursework rather than all the multiple choice exams with the medical sciences, because I find I find it quite dull to like memorize information, but I prefer like doing courseworks and stuff like that. But yeah, you definitely have a lot of more courseworky assessments, I'd say, in the later years as well, which I really enjoyed. It's not just, even though it's a medical degree, it's not just memorizing a bunch of things and then doing multiple choice and short answer questions. It's not really like that.
Absolutely. And yeah, we'll talk about assessments in a minute, but I think you probably had more exams because it was online and COVID. And there was, but it's flipped back to mostly coursework in year 1 as well. So we'll talk about that. Thank you, Nicola. That was helpful to get your perspective. So we've covered most of it, but in terms of what exactly you'll be doing and what will you know in your degree. So you'll do some lab practicals. So this is what Nicola missed out on in year 1. We did a version of this online at home. I remember, I think it was you jumping up and down your sofa to do a step test. So we tried to create an online version of it, but this is really what students come to do in the lab. But you also will do so a little bit of biochemistry, and you will be using microscopes as part of the medical sciences modules. This is where, you learn to assess injuries. This is one of our doctors, so working on the side of a pitch, and you have a pretty nasty injury there that he's treating. So the people who teach you also are experts who work directly with athletes. So it's very nice to have their expertise. This is more practical assessment of what you learn. You will learn how to design strength and conditioning programs for healthy populations. This is what you do in year 2. In year 3, you learn to prescribe exercise for patients. So again, you're working with both populations. You learn how to test performance in athletes. So this is something Nicola is doing at the moment in year 3 with the sport performance optimization module. But you also learn how to apply those tests in patients, and it's the same test, but you get different type of information out of it and different recommendations. And of course, you learn how to solve problems, because that's what you go to university for. And you go to university because you want to study something you're passionate about, and you want to spend 3 whole years of your life studying in order to solve a problem. And the problem might be, how do I make people healthier? And how do I make people more active? And again, some examples of student projects that you might choose to do in the 3rd year. So I've shown you this already. I won't bore you again. I do find it fascinating, but remember, exercise is good for your brain, I guess is what I keep saying. So how are you going to learn? We are back to face-to-face. So we will come and have the full university experience of, being in an exciting big lecture room and having some world-leading professor teach you. So you do get that experience, but we also get a lot of small group and face-to-face. So this is the ISEH. This is where I am at the moment, and the Institute of Sport, Exercise and Health. And these are some of our students doing a bit of group work, and then they're working on some posters, doing some interactive learning together. So we do quite a lot of that. And we want to make sure that our students are followed closely. You work in the lab, and you will learn how to present to each other. So you'll learn some practice some presentation skills, because we do want you to be able to present at conferences after you're done with your degree, if you want to do this, not mandatory. But many of our students, if they do very well on their projects, they then go to conferences and they present their projects at international conferences. So we've had students go to Birmingham, Edinburgh, Monaco last year. We've got some students maybe going to Paris next year, and some going to Boston. So, there's some very exciting opportunities if you do well on your research project to then be part of the scientific community and present it, which is quite nice. In terms of assessments, it's very, very varied. As Nicola said, yes, you do get the exams and you get some MCQs, but it's really mostly about coursework, about designing projects and presenting them. And one of the pieces of work that you will have to do is create a YouTube video explaining certain concepts that you will learn. You also learn how to write blogs, which is very different from how you write an essay. Completely different type of information and language. So we teach you in lots of different ways, and you are also assessed in many different ways. I've mentioned conferences. We also run many conferences ourselves. So UCL runs conferences. The ISEH runs an annual conference in January that all our students are invited to at the Royal Society of Medicine. And there are several other conferences throughout the year that you will be notified about. And finally, the connected curriculum framework. This is just to make you aware that this is how UCL operates. It's very important for us as staff that students feel that they are part of the university and that they're part of the scientific community. So what we don't want is for you to come into the room, sit down, listen to a lecture, and then leave. We want you to be a part of what we do. So active contributors to the scientific and education community. So we make sure that whatever projects you do in your 3rd year are part of what we are developing as scientists, and that you can contribute to that, and that you can take part in the publication process as well if you want to. So this is something that not all universities do, and our program is quite passionate about involving students in research. And we, of course, use our research to teach you. Like I said earlier, we don't teach from textbooks. Textbooks are old. We need up-to-date science from the past few years. And so we teach you with the latest information. Something you should know if you apply to study this program is that the ISEH, which is where I am, the Institute of Sport, Exercise and Health, is one of 12 International Olympic Committee centers. And what this means is that we are essentially so cool, and the research that we produce is so good that it enables us to be part of this select and elite group of centers around the world that focus on athlete health and population health. So there's an element of prestige of studying at the ISEH and being part of this network. Okay, so finally we're on to careers. And we have spoken about this a little bit, but just to give you a couple of ideas with some examples on a screen, what would you do once you finished this degree and what would you go into? One example is elite sport. So you could go into coaching and performance and analysis, which is what many sports scientists do. But you can also go into injury prevention in athletes, which is an advantage that you get in this program compared to other programs. You can become an exercise physiologist, which is what I am, and you can go into hospitals, you can test patients and make recommendations for patients. You can go into exercise medicine, which means that you could work with select types of clinical populations, so either the elderly or osteoporosis or COPD or cancer or diabetes, and deliver exercise plans specifically for these populations, which is quite a complex and very rewarding thing to do. If you're interested in leadership, you can go into policy changes and public health and use your research to influence what the government says. So if the government says that children have to exercise 1 hour a week, which is the current guidelines for schools, 1 hour of PE a week is mandatory, I think that is nowhere near enough. So if I wanted the government to change that, I would have to do lots of research to tell the government that 1 hour is not enough and try to make them increase that to 1 hour a day instead of 1 hour a week. You can stay in academia, become a professor or a researcher. You could go into industries and technology. You can create a startup, make lots of money creating the new cool bike or creating the new supplement or something along those lines. Or of course, you can go and do a vocational degree, which is, for example, physiotherapy, which is an extra 2 years, or you can do graduate medicine, which would be an extra 4 to 5 years. So these are some of the examples. If you have any questions about careers, do put them in the Q&A section. And I believe we've covered this. So UCL main campus, you'll study in a variety of locations. UCL main campus on Bloomsbury. This is the Cruciform just across the street from us where the medical library is. You do have some lectures at the Royal Free in Hampstead, right next to Hampstead Heath, which is a beautiful park. And this is the ISEH, where you will have all of your sports modules. The ICH, I've told you already, is an International Olympic Committee center, but it's also a collaboration with lots of other very prominent organizations who also work in our institute. So being a part of the ICH makes you part of this network. So for example, when we hear about jobs at the British Olympic Association or jobs at the English Institute of Sport, we pass that information on to our students so that they're aware and they can apply for them. And that's it. And then you graduate and you get a lovely diploma and you move on into either more education or a job. Okay, I think I've gone through this, but if you wanted to pick SEMD, you would pick it because you get a clinical background or medical background, insight into disease. You get fantastic transferable skills like presenting at conferences and lots of research skills that not necessarily all universities do at the level that we do. You would be an advantage to students studying just sports science because you get the clinical background and because you learn about injuries, which sports science does not teach you, and connections, lots of networks and career opportunities in London. as well as internationally. And of course, the prestige of being in the top 10 universities in the world where we produce world-class research. So these are many good reasons to be part of UCL. And because really you're doing something you're passionate about. So really, that should be the reason why you pick it. If you're passionate about sports and you're passionate about health and you're bringing the two things together and turning that into your job. These are our emails. Feel free to take a screenshot of this. If you want to email us at any time, you're very welcome to. I will stop sharing screen and see if you have any more questions for us. I guess I've lost the Q&A box. But I'll rely on you. Oh, here it is.
There doesn't seem to be. There doesn't seem to be any new questions.
No more questions. Okay. Oh, there was one. I don't think I addressed it. So Anthony, you're making EPQ about obesity in the NHS. Oh, well done. Yes, we did answer this one. Yeah. Okay. All right. So Nicola, any last words from you?
Yeah, I really like this degree. I think, like Maria said, like if you're really interested in this sort of stuff, I think I actually did like a year of a different degree before I moved on to this degree, like at UCL still. And I think the main advantage of this one in comparison to the one I was doing before, and what like makes me more, I guess, fulfilled in my day-to-day life is I feel like with this, whatever you do after, like even if you just became like an accountant or something and you're just like, oh, I don't want to do any of this sports stuff anymore, at least you feel like it's, I don't really know how to put this, but you feel like you're learning something real, like about health and about the human body, and it's not just kind of abstract concepts. Like you can actually see how this translates to the real world and to actually helping people. So if you like that sort of idea of what to study and keeping it engaging, then yeah, definitely it's like a good degree to do.
That's a wonderful summary. Thank you very much, Nicola. Okay, well, it seems that we have no more questions, so I think we can close the session. Thank you very, very much for attending. Thank you, Anthony, for your engagement and all of your questions. Oh, I can see something came up. Thank you. Thank you. All right. Well, have a great day. Nicola, thank you so much for sharing this session with us.
Yeah, no worries.
I'll see you tomorrow morning.
Yeah.
All right. Goodbye. Thank you.
Bye, everyone. Bye.